All right, guys, we're going to go ahead and do hepatitis and cirrhosis. Okay, so we're going to do hepatitis and cirrhosis with an explain everything. And hepatitis actually starts on page 1006. So what do we know about hepatitis? It's viral. It can be acute or chronic. It's essentially an inflammation of the liver cells. When someone has the acute form, the liver cells, after the patient's getting better, can actually regenerate and resume their normal function. The problem with chronic liver failure is the liver can actually develop fibrosis and cirrhosis. And chronic can also lead to liver cancer and possibly the need for a liver transplant. So we're going to focus on just three types, A, B, and C. There's a nice chart on the bottom of page 1007 that you guys can look at too. What do we need to know about these different three types is pretty straightforward. Okay, so for instance, hepatitis A, you guys know probably that you can get that from contaminated food, water, pick it up in a restaurant, someone's not washed their hands, messes with your food. We have an outbreak of Hep A, right? The thing with Hep A that you guys should know is that it's only acute. Okay, so Hep A is only acute. Okay? Gives you the different routes of transmission, the incubation period, that the onset is usually abrupt. There is a vaccine that is available, and you can also be inoculated. It does not develop, look here, into chronic, and then once you get it, you're immune. The good thing about Hep A, is if people just wash their hands, you have a good chance of not getting Hep A. All right, Hep B. Hep B, this is when we get into contaminated blood products, contaminated body fluids. Okay, so blood products or body fluids, and that comes along with unprotected sex, using needles. The mom can give it to the baby during the birth process. Yes, it can be found in bodily fluids. It's not quite as strong as it is in the blood, but it can be found, for instance, in the saliva and the breast milk. It gives you the incubation period. It's got a kind of a slow onset. There is a vaccine and inoculation. In the United States, because of this inoculation, we've had a sharp decline in Hep B. And so the inoculation can provide you with immunity. The problem with Hep B is then these people can develop chronic liver disease. So these people can develop chronic liver disease with Hep B. Get into Hep C, pretty much can be transmitted as Hep B, and there is no vaccine. It is the one that has no vaccine. It can turn into chronic. And so that's an issue. And remember, chronic means you can develop fibrosis of the liver, cirrhosis, need a liver transplant. If you guys look at the top of page 1009, it kind of goes over this acute versus chronic signs and symptoms of hepatitis. Just read through this. I think probably my biggest concern is that you make sure that you understand the different terms, for instance, that are used. If not, take the time to look them up. If you flip the page and it talks about the diagnostics, we certainly want to watch and monitor the liver enzymes, the ALT, the AST, etc. As far as a liver biopsy, that is not necessary, especially in the acute form. That might be done in chronic if there's concern about cirrhosis or need for a liver transplant. The main thing is if you look at the top of page 1011, it shows you that there's different tests for the various types of viral hepatitis. It can be quite complicated. We are not going to learn this. Just know that there's antibody antigens that can be tested for each particular type of hepatitis that would identify which type of hepatitis the patient actually has. The viral load itself is not specific to hepatitis. It just says, hey, we have a virus within our body and we have to look for it. As far as meds, we've already talked about the vaccines that are available for A and B. If someone is exposed to hepatitis A, then they can get a dose of immunoglobulin within 2 weeks of the exposure. The sooner the better. As far as treatment, there's no specific treatment for hepatitis. It's kind of a symptomatic treatment. There's also no specific diet therapy for someone who has hepatitis. Just a couple of things, if you're kind of looking through your book, it does talk about drug therapy. For instance, if someone has chronic B or C, they can take interferon or the ribavirin. They can also take the ribavirin for acute hep C. The deal with these drugs, both of them produce flu-like symptoms, but the ribavirin, if you guys are looking on page 1013 in your book, it does remind us that you can't take it because of birth defects. Okay, taking care of people with hepatitis. Let's focus first on the risk for infection. Okay, the risk for infection is, obviously it's real. There's a really nice table on the top of page 1014. It kind of goes through the highlights. And so, for instance, with Hep A, it reminds us, what we need to do: hand washing, hand washing, hand washing. Good personal hygiene. Someone does get Hep A, and they're hospitalized. Most of the time that's not necessary. Just know isolation is not required. Only a private room would be required if the patient, is incontinent of stool, has poor hygiene. Let's say that you're exposed to Hep A, then you should get the vaccine if you've not had it, and immunoglobulin should be given also. Risk for infection as far as Hep B, really the best thing here is to prevent. So identify people who are at risk, test them. If they're not positive, then go ahead and vaccinate them. Most of you guys, for instance, probably have had the 3 series shot for Hep B. If, let's say, you do get stuck in the hospital by a dirty needle, then post-exposure prophylaxis would be the Hep B vaccine and then the immunoglobulin, hopefully within 24 hours of exposure. And then Hep C, as we said, there's no vaccine. And so we just want to identify people at risk and make sure that we teach them, how to prevent from becoming infected. And then also now we test all blood, organ, and tissue donors for Hep B. As far as activity intolerance, there is a definite need for balance, a balance between rest and activity. And then nutrition, a lot of times, is a big issue. We want to make sure they're not taking anything hepatotoxic, so for instance, no NSAIDs, no alcohol. Give them an antiemetic prior to eating. Encourage them to eat small, frequent meals, no strong odors in the room. A diet that's high caloric, carbohydrates, moderate fat and protein, so the liver doesn't have to work too hard to break it down. Moving on to cirrhosis. So we have an example of what is a normal liver versus a cirrhotic liver. We're on page 1017. In the United States, the biggest reasons we have cirrhosis are chronic Hep C and alcohol abuse. So what happens during this time is that the liver cells try to regenerate, but as they regenerate, They do not do a very good job. It's disorganized. You have abnormal blood vessels, overgrowth of new tissue, and this fibrous tissue distorts the liver, as you can see in here, and gives it this fibrous appearance. Lots of scar tissue.